And also, I think that not just in the US, but also in Italy, as medical students, we don't get to do a lot. We get to watch, we get to learn, obviously, and discuss cases and, you know, diseases and all of that, but we do not touch the patient as much as we do in Brazil. I think this is, in general, I think people who come to Brazil, they comment on this as well, that they get to do a lot. People that come as exchange students, for example, they get very excited because they learn to suture, they learn to do a lot of things that they don't get to do in their home countries. And I'm not saying that it is impossible for you to do those things, because when I was in Italy, they did give me some opportunity to do some things, but it was definitely not as much as I have here that I had here in Brazil as a medical student. I'm still getting used to the fact that now I'm a doctor. But when I was a student, I did have a lot of opportunity to do a lot of things. And when I was abroad in the US and in Italy, it was very, very difficult for me to have, direct contact with patients, or even to have opportunities to do things on patients, to suture. I didn't suture, for example. I didn't do anything that I think is risky, I guess. I was just there watching, discussing, but from a certain distance, I would say. So I think this was the greatest difference. I don't know if it's because they do not have a public health system. In Italy, they do, though, not in the US. But in general, I don't know if it's because of this, or if it's just because it's their culture. Like, culturally, maybe they do not allow students to do much, to do a lot. Or maybe because I'm comparing it to Brazil, I think that is little, but maybe it's not even that little. It's just that in Brazil, we get to do so much. Maybe because we have a lot of work to do. So they never refuse work. They never refuse any, medical student who wants to help. So maybe that's why, I don't know.
There's no such thing. There's no such thing as a observership in Brazil. Every experience is a hands-on experience. Get to work. Go
Yes,
do something.
exactly. We don't even have this term observership here in Brazil. It's only like hands-on experience, because you will always get to help because we need the help. So maybe that's why we allow students to do so much here.
But that's a very tough debate, and we are talking here about medical students, but this also applies to residents, for example. I think there
Yeah.
have been studies, and here is my great source. There have been. Where is the study? I'll check later. But there have been studies that have shown people performed surgery on by residents, for example, have higher rates of complications than people performed surgery by attendings. And this is pretty much obvious. The more experienced the professional, the better the work, so to speak, whether it's
Yeah.
intellectual or manual or both, as we could, for example, classify surgery, both intellectual and manual. And there is this strong debate about, for example, how should residents, surgery residents, for example, learn to perform surgery? Should they actually learn to perform on the patient? Because this brings increased risk to patients. And more we have like virtual reality systems, and we have many simulation devices. And personally, I believe that's the way things will go. We'll have more and more simulation virtual devices, up to the point you can only perform your first surgery on a patient when you've passed some kind of test on the simulation device. I think this is most likely where we're going to. But here we are talking about something even prior to that situation, which is,
Yeah.
should a medical student learn to suture, for example, or to intubate someone, or to place a central venous line? And there's a strong argument to be made that this should be based on necessity. Do you have enough professionals to perform those things? But
Yeah.
I think we have the good side and the bad side here in Brazil. I'm
Yeah.
somewhat against just letting anyone perform medical procedures having a brand new physician, for example, because this is the way things work in Brazil. Any physician, any doctor can go and perform neurosurgery, at least according to our law. That's allowed. And I don't feel safe to do these kinds of procedures, for example. I think we need better training. Whether that should be in medical school or in residence, I think is the great question. Based on what you've seen on the United States and in Italy, have you had contact with other medical students? How do you think these different approaches influence on their preparedness, on people's abilities when they leave medical school?
I think they feel very unprepared regarding procedures, but they are very good in theory. You know what I mean? Study wise, they are very good. I noticed that medical students, I didn't have any contact with American medical students from the US because at in the research that I was, there were no other medical students. But I can talk about Italy in this aspect. They were so prepared, theory wise. They knew everything that the professor would ask. They were prepared to answer. They were very prepared theoretically wise, like theory wise. Especially, I don't know if you know this, but in Italy, all the tests, practically all the tests, the exams are oral exams. So the professor can ask basically anything about anything at their test. So at their exam. So I think they are very prepared in theory. But practice wise, they are not, they feel unprepared. And that was a constant complaint. I heard this from medical students a lot there in Italy. They were like, they really wanted to get to do stuff and they were not allowed to. But I also think that this is not so bad, I would say, because in those countries, for you to work as a doctor, as a medical doctor, you have to go to residency. As opposed to here in Brazil, where you don't have to go to residency, you could just start working. In the US, you have to. It's an obligation. You can't work as a doctor if you don't go to residency. So I think that even if they don't have a lot of practice during medical school, that's not a huge problem because they will get to practice in residency. And I think that their residencies are amazing and they have really great programs. So I don't think they lose much by not being so active during medical school. In Italy, though, I believe I'm correct about this, but I would have to research a little bit more. But from what I remember that they told me, you can work right after completing your medical school training. However, you can't work with certain specialties. You can't, not certain specialties, with certain types of work. You can't, for example, be work with emergency, like more serious emergencies or things like that. But you can, for example, do primary care or occupational medicine. So you can do, there are, this I'm sure of, I'm just not sure of which types you can do, but you are allowed to do some things. There is probably a list of things that you can do. But right after you get out of medical school, you can work. But you just can't do complex things. For that, you need to go to residency. So basically, to sum up, I think that they don't get as harmed because of this, because they are basically obligated to go to residency afterwards. And in residency, you probably get to practice a lot. So it's not such a bad thing after all. You know what I mean?